Hi all, welcome to Registered Nurses channel. To- Today we are going to discuss about heart failure and other important topics. Before going to talk about heart failure, just I will explain about the normal circulation. As we all know that our heart has a fourth chamber, right atrium, right ventricle, left atrium, left ventricle, right? From upper part of the body's blood into the right atrium through the superior vena cava. From lower part of the body's blood into the right atrium through the inferior vena cava. In right atrium, it will contract and the blood is ejected to right ventricle through the tricuspid valve. It will be here, yes. When right ventricle contract, blood will be ejected to the lungs through the pulmonary artery to the lungs. Once the blood purified from the lungs, the blood will become oxygenated. So this oxygenated blood will come to left atrium through the pulmonary vein. What happened in the left atrium? Left atrium contract the blood and blood will ejected into left ventricle through the mitral valve. Left ventricle is the most powerful chamber of the heart. It consists aorta, which will pump the blood for the entire body. The inability of the heart to maintain the adequate cardiac output, it is called heart failure. Sometimes it is known as congestive heart failures. It occurs when your heart muscles doesn't pump blood as well as it should. Certain conditions such as narrowed arteries in your heart, the coronary artery disease, or high blood pressure, and gradually leaves your heart too weak or stiff to fill the pump effectively. That is called heart failure. And this is the question for your exam. What is the right side heart failure symptoms? Distended jugular vein, anorexia, GI distress, weight gain, dependent edema, fatigue, ascites, enlarged liver, nausea, vomiting, and hypertension. And what about left side heart failure? Shortness of breath and coughing, palpitation, fatigue and tiredness, hypoxia, tachycardia, fluid overload. What is the example of loop diuretics? Is furosemide. DVT, deep vein thrombosis, formation of clot in the deeper vein of legs which impaired the circulation. That is called DVT. The important question is, test that is used to check for DVT is Homan sign. The intervention of DVT is very important. The first intervention is should administer aspirin, provide bed rest, affected leg should be elevated with a pillow, start infusion of heparin. Meanwhile, you have to check the APTT level. If symptoms sustained, stop heparin and start warfarin. Meanwhile, you have to check PT or INR. After discharge of warfarin, should continue to instruct to wear stockings to prevent recurrent of DVT. What is the side effect of loop diuretics? Hypokalemia and hyponatremia. Mannitol, just important point, mannitol is hypertonic solution and which is used for reducing cerebral edema and ICP. Thank you so much for your valuable time. Please subscribe my channel and click the bell icon so you can able to see my coming videos. Thank you so much.